I'm a registered nurse and I have a master's in pediatric nursing. So my master's that I have, in addition to, basic nursing skills that I have, I can see my own patients, I can diagnose them, I can order tests on them, and I can prescribe medicine. So I work in a pediatric primary care office. We do children's physicals, so that's from newborns up to the age of 22. We spend a lot of our time doing those physicals and then also seeing patients for sick visits or acute visits. We see them diagnose and treat ear infections, strep throat, asthma, broken bones, rashes. We do some basic mental health diagnoses and treatments, and many other minor things that people will come in for. We manage a lot of conditions and then just see a lot of acute visits. My office also has an urgent care for kids. So we see children up from our practice or children up to the age of 17 that are not in our practice. And we see them with a lot of complaints like fevers, minor injuries, rashes, that sort of thing. So I spend half my time on the primary care side and half my time on the acute side. So it's not quite like emergency level or urgent level care, but we do a lot of just very basic things. Let's see. So I work in Rhode Island. I live in Massachusetts, but live and work in Rhode Island. And where I work, we have independent practice. So that means that I can see my own patients. I don't have to have anything signed off on by a doctor, but I do work with 4 doctors and 3 other nurse practitioners, and we all work very collaboratively. So I do run a lot of things by the people I work with. We all tend to do that, kind of discuss patient cases and look to each other for advice and everything. In some states, based on where you work, nurse practitioners do have to have a doctor that they work with who signs off on everything. But in Rhode Island, we don't have to do that. Let's see. So in my practice, I do pretty much all the same things that the doctors do. The only thing that they really do that the nurse practitioners don't do is round in the hospital. They go down and round on the newborns after they're born until they're discharged from the hospital. And that's just something that the nurse practitioners at this time don't do. So as far as my education level goes, I have a Bachelor of Arts from Holy Cross. I majored in math, and I also had a specialty in pre-med. I wasn't sure when I got to college what I wanted to do. I had thought about medical school. I thought about doing pre-law. I thought about English, journalism, kind of a lot of different things, but ended up majoring in math. And with my pre-med specialty, I got a lot of my basic sciences out of the way. So I did have to take a couple classes after I finished college before I went to nursing school. I had to take anatomy and physiology and microbiology. I took 2 years off after college because I wasn't really sure what I was going to do yet. I got some medical experience working at a doctor's office. It was an adult office, but I ended up going into pediatrics. And then I applied for nursing school 2 years later. And because I didn't have a nursing degree yet, it took me a year to get my nursing degree and then 2 more years to get my master's degree in pediatrics. So I kind of did it the long way a little bit. Had I gone to college for nursing, I would have been able to do that for 4 years, 2 years to get my master's, and then would have been done. But I did it's basically called a bridge program where I had a bachelor's degree already, took a year of classes to get my nursing, and then moved on to get my master's. Let's see. So yeah, I originally wanted to go to medical school at one point, and I decided that because I wanted to do pediatric primary care, the NP route was a route that I could get to a little bit quicker. And the nurse practitioner model of care tends to be based more on preventative care, patient education, and just overall healthcare promotion. And that kind of lined up with what I wanted to do and the kind of healthcare that I wanted to practice. So I ended up going to NP school instead of MD school. NPs do work in specialties. They do work in hospitals. They're a little bit more prevalent in the primary care setting, but they do work in other places too. And then as far as what I did in high school, when I was in high school, I didn't know what I wanted to do. I had thought about, like I was saying before, law school. I thought about going to medical school. I thought about being a journalist. So what I did in college or in high school to kind of prepare for just life in general was just take a lot of AP classes, and I did a lot of clubs and activities just to have kind of a well-rounded resume for college. So I was involved in student council. I was in the band. I played French horn. I ran cross country. I did a lot of stuff with the science fair, National Honor Society, and I was an editor on the newspaper. So those were kind of my biggest activities. A lot of those activities involved a lot of volunteering too, like National Honor Society and Student Council had a lot of volunteer activities. Um, and then as far as, if someone wanted to go into nursing or become a nurse practitioner, my biggest advice would just be, talking to as many people as you can, maybe shadowing if you can, getting, volunteer opportunities, and just kind of having a very broad experience when you're in high school so that you can pretty much, have whatever opportunities you want in life. I think the more broadly you get involved in things in high school, the more prepared you are for college. So those are kind of my thoughts.
Wonderful, thank you. Students, do you have any questions for Christine? If you do, just put them in the chat.
How long does it take me to go to work? So my commute is like 40 minutes. That's the question? I have a 40-minute commute to get there.
I don't have a question so much as to say that when you were beginning, you had a lot of indecisiveness. And I think that's sometimes what students need to hear, is that they don't need something as specific as knowing exactly what they're going to do for the rest of their time, but to be curious like you were, to be involved in a lot of things, so that when it was time for you to make a decision, you were making a decision that you could live with and enjoy for the rest of your career. So I just wanted to mention that. I was also one who wasn't exactly sure what I wanted to do. I got a bachelor's before eventually going into teaching, and I bridged into teaching and eventually guidance counseling. So I think it's an important point to make, that we don't necessarily have to know exactly what we're going to do by graduation, or even sometimes by the graduation of college, but to expose ourselves to a lot of options so that when we do make a choice, we're making a healthy and happy choice for the rest of our career.
Yeah, absolutely. Yeah. I was definitely all over the place. Like when I was applying to colleges, I actually at that point in time wanted to do broadcast journalism. And I applied to, I think, 3 programs that focused on broadcast journalism, and then several liberal arts programs. And then as I was making my decision and kind of researching the schools, I ended up, picking Holy Cross because it had such a broad program, a broad liberal arts program. So I figured with that, I could pretty much do anything after that. It was definitely a longer route. If I'd known I wanted to do nursing at that point, I could have gotten my nursing degree a little bit sooner. But I loved my time in college, and I loved kind of having all those options open to me. And I know I was lucky to be able to explore a bunch of different options.
Right. Thank you.
Mhm.
Students, do you have any other questions for Christine about the field of medicine or nursing in general? Christine, just a quick question. How does what's going on in our world today impact you and your work as a nurse practitioner?
Right now, things are a little up in the air, a little crazy. Everything is kind of changing day by day. So what's going on as far as coronavirus is not having as much of an effect on children, thankfully. It's definitely very scary how it's affecting adults, but thankfully for the pediatric population, it's not really affecting us too much. But children can be asymptomatic carriers of it. They can transmit it to other people. So right now we're having to be really, really cautious about practicing social distancing at work. So having patients that can stay home, people that have cough and fever. There's a very big shortage of swabs in Rhode Island, and I think a lot of other states too. So you're only able to really get a swab on a patient if they're hospitalized, if they're a healthcare worker, if they live in like a group home or a nursing home where they would be more likely to be spreading it. So our patients, because they're not going to really have higher risk situations, we're not able to get swabs on them. So when we have patients with cough and fever, we're trying everything we can to keep them at home, to treat them at home, and really only bring them into our office or into the hospital if they're having difficulty breathing. So our numbers are definitely going down. We're not seeing as many people, but we're still trying to see as many of our well visits as possible. We want all of our kids to come in for their normal, 2-year visits, their normal 4 or 5, all their normal healthy visits, because we want people to stay up to date on their vaccines. And we want to make sure that our babies are still growing and developing well. So we're trying to keep some normalcy in some ways, but then make other changes. And we're also doing a little bit of telemedicine. We're doing some FaceTiming with patients if we can. And because we're in a pandemic, certain things have changed. Like we can FaceTime with patients on our personal home device or our personal cell phones, even if it's not encrypted to be HIPAA certified, just because we're in the middle of a different situation right now. So we're doing more telemedicine and just a lot of work over the phone with our patients.
Great. Thank you so much, Christine, for being with us today and for sharing some about your career and giving us some insight into what's going on in the medical field at this point. Students, if you have any questions for Christine after this session, you can email me at cbodek@rpsd.org, and I'll be sure to get those to Christine. Thank you so much.
Yeah, thank you. Feel free to ask any questions.
Thank you, Christine.
Thank you, Christine. Stay well.
Yes, you too.